It has been my privilege to be a private practitioner who is on service in the Bioethics Advisory Committee for the last 5 years. And so it's been fascinating for me to see the way in which bioethics interacts with law, interacts with medicine, interacts with science, interacts with different disciplines, and how we can put that all into this cornucopia of ideas and come up with an ethical solution. What I can bring to the table in terms of my own legal knowledge and experience is only part of the overall picture, and although it can help to inform some parts of the discussion and form part of the consensus, but we are on this wonderful conversation as professionals to do something and to find out how we can come to the best solution. Serving has been a challenge, especially with work demands. The one thing that has kept me going is, in one word, passion. I think when we get caught up in this mission that's larger than ourselves, you don't have to watch the clock. You will last the pace.
I'm a radiation therapist by profession, and I've been in the profession for the past 20 years when I'm able to serve the Implementation Committee for State Registration of Radiography and Radiation Therapies. And one of the biggest milestones that we have achieved is when we are eventually state registered this year. Serving in this committee has given me the opportunity to work alongside with the various radiographer and radiation therapists representing their institution. I have gained a lot of experience through their sharing of good practices. I would like to be the gatekeeper for the profession to make sure that we only get in the right people with the right qualification. Let your passions drive you through this journey. It is not just the profession, but most importantly, the patients out there who are counting on you.
I am currently serving on the KK Women's and Children's Hospital, the Medifund Committee. It is a very humbling experience to be on the committee, really, because you get to see the strength and resilience of some of these families. So despite tight budgets and the medical costs that they have to bear with, they still persevere. In a way, I feel a sense of achievement when we are able to help these families. So I think that sort of motivates me to want to carry on through all these years. And of course, wonderful committee members, so we click very well. So there's a sense of understanding. I would say that if you want to make a difference in the lives of others, one very strong motivating factor is how these families are really depending on us to help them out of very difficult and trying circumstances. So the satisfaction we get is very much intrinsic to the work that we do.
Our role is actually to advise on the immunization recommendations for Singapore. Well, being a pediatrician and a member of a committee, I like to think that my achievements are mainly in the area of the childhood immunization program. How it has changed over the 20 years, how we have implemented new vaccines into the program to benefit our children. I think it's an important role we play in this committee. We impact on public health policy in vaccination. And personally, I'm a vaccine advocate. Maybe it's from my experience as a pediatrician. From my practice way back, I'm really old enough to have seen children come to hospital getting fatal complications of measles. And this is just an example to show that public policy really saves lives. It improves the quality of life of our children. And I really like to be part of it. We should give back to the medical profession. I know it does encroach on your schedule, it encroaches on your free time, but it is a fulfilling experience, and I think for all those who are just starting out or all those who are running other committees, for the more senior members, I'm sure they will share with me that the experience is good, the sacrifice is worthwhile, and actually you contribute to the health of the country, and I think that is very important, and if we are able, it's something that is honor to serve.